Developmental regression, loss of previously attained developmental milestone. So we're going back from that milestone back towards a primitive type of behavior. Almost always has a bad prognosis. Keep that in mind. Onset, age before 2. Here you might be thinking about mitochondrial disorders, including your mitochondrial encephalopathy, lactic acidosis, and stroke-like symptom. Hypothyroidism, cretinism, neurocutaneous disorders such as neurofibromatosis, and gray matter disorder. Remember, bad prognosis, onset before age of 2. White matter disorder, metachromatic leukodystrophy, amino acid metabolism such as PKU or phenylketonuria, and enzymatic disorders. These are developmental regression, clinical pearl, bad prognosis, here referring to those differentials before the age of 2. The neurocutaneous disorders that we'll walk through quickly. It's called tuberous sclerosis complex. Not tuberculosis, but tuberous sclerosis. This is an inherited, hereditary issue. Neurofibromatosis. Especially we have neurofibromatosis type 1, which is known as your neurofibromin protein, or neurofibromin 1 protein. And with this, you've heard of cafe au lait spots, and so on and so forth. Sturge-Weber. In vascular pathology, with Sturge-Weber, you've talked about port wine syndrome. And remember, with Sturge-Weber, it's a problem with the leptomeningeal blood vessels, and therefore may result in new onset seizure in this patient. Familial telangiectasia, or you've heard of hereditary hemorrhagic telangiectasia, Alzer-Weber-Rondeau. Von Hippel-Lindau disease. Remember, with von Hippel-Lindau disease, you could have bilateral renal cell carcinoma in a very young patient. Along with this, there could be hemangioblastomas of the cerebellum and the retina. And we have incontinent pigmenta and ataxia telangiectasia. Let's talk about tuberous sclerosis. Autosomal dominant disorder. To begin with, please understand that this has nothing to do with an infection. Incidence 1 in 10,000. There are 2 gene loci. You have TSC1 on chromosome 9. Please memorize hamartin. Now, with hamartin, you can play with that a little bit more, and this is what I recommend that you do. You've heard of in pathology, hamartomas. And hamartoma would mean increased proliferation of cell, but completely non-neoplastic by definition. With tuberous sclerosis, there are important hamartomas that may be seen. And one of these hamartomas could be seen, well, perhaps in the heart. What I'm saying is, hamartin, chromosome 9, at least know TSC1. TSC2, T as in 2, you can use that to advantage with the gene tuberin, T. At least know hamartin with TSC1 at this juncture. The classic Voigt triad of syndrome include the skin lesions. The topic is under neurocutaneous. And the skin lesions include something like your ash leaf spots, shagreen spots, might be convulsions, and these are your tubers that you might find in the brain, and there might be intellectual disability. With tuberous sclerosis, things that you're paying attention to. The primary symptom cluster. Remember that skin? In the skin, it's called adenoma sebaceum. Ungual fibroma, cortical tubers, those tubers will be found in the brain. Those are subependymal nodules, a multiple retina astrocytomas. The secondary symptoms, infantile spasms. The ash leaf spot, as the name implies, will be white, and it's hypomelanotic macule. And of course, that referring to blanch, or I shouldn't use the word blanch, but we'll say pale, and it would be hypopigmented. In the heart, we have these rhabdomyomas. Remember, in the heart, in cardiology, very rare that you might have a cancer in the heart. However, if by chance you think of a benign tumor that might be located in it, and it's a rhabdomyoma, then please know that this could be part of tuberous sclerosis is my topic. Renal angiolipoma in the kidney, and first degree relative with tuberous sclerosis complex, or TSC. And keep in mind, once again, at least know TSC1, which then represents hamartin. There is no condition that we see here in either primary or secondary in terms of symptom that truly would be malignant, is there? No.